As a security officer, Frank Rizzafi can walk up to 10 miles every day. He also has mild to moderate asthma, which he controls with inhaled corticosteroids.
There was a regimen that I was supposed to follow. It was 2 puffs in the morning and 2 puffs in the evening.
That is the recommendation of the current U.S. National Institutes of Health guidelines. But then Frank entered the BASALT, or Best Adjusted Strategy for Asthma, in the long-term trial.
It's an acronym that reflects our purpose in attempting to help doctors manage asthma by giving them some guidance as to what the best way of adjusting inhaled corticosteroids might be.
Dr. William Calhoun from the University of Texas Medical Branch in Galveston and co-authors conducted a randomized controlled trial with 342 adults. Participants had mild to moderate asthma requiring low-dose steroids for control. Over 9 months, researchers compared one group receiving steroid dose adjustment based on physician assessment to a second group that received biomarker-based steroid dose adjustment using measurement of exhaled nitric oxide, and a third group that received symptom-based steroid dose adjustment.
Adjusting their inhaled corticosteroid dose based on symptoms was just as effective as the US NIH guidelines and just as effective as with biomarkers exhaled nitric oxide.
The study appears in this week's JAMA, Journal of the American Medical Association.
The symptom-based arm resulted in a reduced use of inhaled corticosteroids, a 50% reduction. It also resulted in a reduction in exacerbations in the autumn, a time when exacerbations are typically high. And it also resulted in a reduction in absenteeism from school or work.
Now Frank takes his medication only when he has symptoms.
I'll take 1 puff in the morning, and that usually takes care of it the rest of the day. I feel great. I feel really good.
We can't extend the findings of BASALT to every asthmatic patient, and so it's very important for patients to check with their doctor first to see whether this strategy might be appropriate for them.
Catherine Dolf, the JAMA Report.
Okay.